I thank you, Dr. Umesh Khanna, for giving me this opportunity and the Mumbai Kidney Foundation. I see a lot of sleepy faces. Now wake up. Okay. So I am Dr. Vilas Naik and I practice in a very small third-tier city, Kolhapur. First of all, this is not my personal slideshow. These are not standard guidelines to set up a transplant unit all over the country because it differs as per the hospital, as per the city, as per the state. And the talk would be how did I reach a point where I could set up a transplant unit in a nursing home. I passed out in 2006 from GSMC, Mumbai. This is my Toronto fellowship photos with the very Dr. Oriopoulos, Dr. Joan Bagman, and this is the beautiful Toronto General Hospital building. Okay, so regarding fellowship, a lot has been discussed, but I'll tell you a few things which I personally have experienced. So when you go for a fellowship and work with these people, your perspective changes and you learn to say no. I do not know a certain thing, rather than saying I know everything. The second one is, in your early 30s, you have been struggling with your MBBS entrances, your MD entrances, your DM entrances, and working day and night with your long hours. You really get a break, 8 hours, 5 days a week. You do get time for your family. Third thing, well, if you come back to your practice, your first international trip will be after 8 or 10 years of your practice, when you start earning some money and will still be hesitating, like if I go for 15 days or 8 days to North America or Paris, all my patients will be going to my nephrologist next door. So this good break of 2 years is learning, enjoying Europe or North America or Australia along with your spouse, and you do get your good family time. So this is 4 things I learned from my fellowship. This is a transplant lecture, not a fellowship one, but just to summarize. So I came back to a very small third-tier city where still the patient believes absolutely in his general practitioner, irrespective of his qualification or intention. There was no difference between a urologist and a nephrologist. 99% of the practitioners did not know the difference. Urologists did kidney biopsies. Some also treated acute renal failures doing dialysis. And the nephrologist need was not felt. I was the first nephrologist in 5 districts. Still, I did not have any cakewalk because most difficult part was to change the mindset. And the most egoist and the difficult people you face would be your physicians. They know everything. They 100% know more than you. So haven't we practiced till date? What do you do other than dialysis? Consultation charges are too high. You consult once, we'll manage the rest. We have been doing all our life. And the doctors themselves back in 2009 believed that dialysis is a waste of resources, money, especially the chronic ones, and all acutes were converted into chronics without further evaluation. So when I reached this place, transplant became more necessary and very, very difficult, both. Because this is one exclusive job of a nephrologist, so you have to start something. And with the people where the doctors don't know difference between a nephrologist and a urologist, you are still talking of transplant. So what was existing in the city? 2 medical colleges, 1 government and 1 private one. 4 small dialysis units, 1 in government. A good thing was in a couple of years later, a 200-bed corporate type of hospital was coming up, which was my best bet to think of transplant. And there are 7 qualified urologists in the city who had done transplant some years back, and they did have some idea during their fellowships, and they still were, somewhat excited about the thought. What was required the most? Believe me, nothing else. This is adequate. And to change the mindset of the people, hammer them that this can be done in this small city, and this is feasible, and this is workable. And as no one wanted to employ me, and I had already a family to support, I rented a small place. This looks bigger than what it actually is. But it's like 2,000 square feet, 800 square feet place per floor. So I bought 3 machines, a couple of ventilators, 4 monitors, 12 beds, a small pharmacy as well as a lab to support my, earnings, and went ahead, let's see what happens. And here my Toronto earnings helped. One more thing, when we passed out in 2006, we were paid 12,000 rupees during our last year of DM years. And when we went there, it was like 2.5 lakhs, and that was a lot of money. So that is one thing. I don't know what's the present situation, that you can discuss later. And things worked out well for me in this small setup. At the end of 2.5 years, we did like 500 dialysis. Guys started earning money, bought my own place of 30 bed, set up an 8-station unit with a OR, lab, pharmacy, a comprehensive small setup, which Dr. Umesh Khanna had mentioned. Yes, but still, when you are a nephrologist, you always want to do transplant. Sir might not believe me that. Okay. So it's a happiness both for the patient and the family as well as the nephrologist. So that passion said, now it's time, I will start doing something for that. So other than passion, you did a lot of things. An institution where the person or the head of the institution should be convinced that this is the need of the time. There was one visionary owner who agreed to my idea of starting a transplant unit in this small city. A transplant team and only one nephrologist was available. So it started from training your with your own money, sending them to Chennai, Mumbai, to various Mohan Foundation lecturers, getting them certified as a medical social worker and a transplant coordinator, training your OR staff, nurses, etc. And building a transplant surgical team, which was relatively easy. People from Mumbai and Pune helped me a lot. Dr. Mukesh Shah, Dr. Ashik Rawal, Dr. Bipin Vibhute from Pune, everybody was more than willing to come, start a transplant program and train our existing and interested young urologist. Now came the most difficult part, the legal. So application to the regional deputy director of health services office, your regional office in your city, with a whole bunch of documents. They had no idea what to do next. So we visited them. They had kept the file under the table for 6 months, and after 6 months we said, please forward it. And they discussed a lot and finally forwarded it without doing anything. It reached the Director of Health Services, Mumbai. Document scrutiny was hell of a lot of job. The hospital admission should be doing it, but no one had any idea, information, nor interest. So they asked for a document every day, and I visited 9 times, sat in the Director of Health Services all day and completed the documentation. And the Director of Health Services issued a letter of inspection to our government medical college in our city, who had neither a nephrologist nor anyone who had any information about transplant. And they kept the file with them for 4 or 5 months. I used to go and request that, do something. He said, I'll contact the Director of Health Services. Finally, they were forced and go and do some inspection. So they did come and did some inspection. I don't know what did they do. And finally, the institute was issued a transplant letter. Hooray! After 18 months of hard work, mostly by me. I had prepared 8 patients waiting for transplant, and there was a sigh of relief. Yes, we are going to do something. Back to the institute side. I met him. Sir, now we have got 8 patients who are ready. Tell me what to do next. He said, well, we are going to charge 5 lakh rupees for the patient. I said, back in 2012, 13, the cost was lower in Pune and Mumbai. I said, sir, this is not possible. Who will come to you? He said, no, this is my charges. Okay. I asked him, how much will you pay me? Well, he said, you do any number of visits per day, you'll get 500 rupees. I said, and it will be your responsibility. I have you to notarize that you are responsible for the good and bad of the patient. I said, okay. So that's it? Yeah, he said, that's it. So after all this effort, my mistake was to say, not discuss this earlier. So I refused, kept my foot down. No, I'm not going to do transplants. Believe me, my friends, never work for peanuts. That will be, you will be insulting your knowledge, your hard work and your qualification, and whatever you give free of cost has no value. So say no, you might lose it, but refuse to work. This is one single advice I'm going to give you. Never work for peanuts, because you will be considered monkeys then. So never work for peanuts. So after the failure, what next? There was another medical college, a private one, whose intention was to establish a MCH program for urology, for which transplant was mandatory. So I had some luck here. So all the same process again. This took 6 or 7 months. I had a lot of experience running around now. Finally, the first transplant done in April 2015, and the transplant program started. So we did 25 transplants in the next 2 years, and the cost of the first 15 transplants was around 1 lakh, mostly into the government schemes, including medicines. This was needed to kickstart the transplant program and make people believe that this can be done. Whoever had 7 or 8 lakhs went to Mumbai, did not stay with me. So these were the people who couldn't have ever done any transplant anywhere. So I had limitations as well as complications. No immunology lab was available. CNI levels were available after 2 or 3 days. Biopsy after a week. Microbiology backup was not good. PCRs were not available that easily back then. 7 or 8 days later, I used to get some PCR report. I don't know the validity of that. Transport, cold chain, maintaining the cold chain, nothing. I also did not have any backup system for any complications, good or bad things that happened. But I had my backup system, my seniors. I called Jatin Kothari, Vishwanath Pilla, Alan Almeida sir, Dr. Hase, who had trained me. And with a lot of complications where I couldn't handle, I used to refer them to GSMC, my alma mater. And they kept them for months together and did fix them and then send back to them. Okay, so transplant program was started. In November 2016, I completed building our own hospital. This is a 100-bedded hospital, multi-specialty hospital I own. So my dream was to do transplants in my hospital. Probably that was supposed to come true. So sole person responsible for all the goods, all the bad, still half of my patients don't know that I haven't operated them. They still feel that I have done everything. If in spite me telling me, no, I am not a surgeon, he said, no, I only know you. So that is good part. And there are many bad parts. Whenever it fails, they will like, you are the only responsible person. So to the nursing home, not even a hospital. Till 2023, we did 130 transplants, 14 deceased donors, all swabs. Last 12 have been laparoscopic. We upgraded ourselves. Second transplants, we have done absolutely free just to promote single mother, girl, child, just our part. And 50% have still been done under government schemes, including medicines. So limitations do exist. We still don't have an HLA or CDC cross-match lab. Biopsies and CNI levels are delayed. And I do not have any papers or presentations since 2009 to now. Believe me, I haven't done anything. Okay. So we have started a liver transplant program in this hospital itself. Apollo has a tie-up. We are yet to do our first one. It's being worked up. Maybe probably in a month or so we'll be doing our first liver transplant. Dr. Kher might ask me, why do you want to do transplant in such a compromised, limited state? I would say like up to 50 or up to 80% of these people who I have transplanted are from villages. Some are like from the mountains, to reach the district place, Kolhapur, they require like 2 kilometers of walk, then 3 kilometers of driving by a bullock cart and then getting a bus. So they could have, even if they have given 10 lakh rupees and asked to go to Mumbai or Pune, along with 10 of their family members, 8 to 10 visits for their workup, for their meetings, for their legal aspects. No, none would have got transplanted, even if they had any amount of money. So this is not only the economic aspect, it's the social aspect, the social hindrance. Okay, this can be done. So probably I started a transplant unit in place where otherwise nobody could have got transplanted. Now we are getting patients who voluntarily come for quality work rather than just it's available free of cost. So we have started laparoscopic program. That's, I think, I got some limitations in life because of all this. I don't have any international flights. I had to come yesterday evening to reach this place because I don't have any direct flights from my city. My traveling time is 3 or 4 times as compared to the metros. I still am in third tier city where there are no international schools or classes for my kids, but I do have some advantage. I have been playing tennis with my kid as they grow up. I do have a lot of time. I have been biking to Leh and Ladakh. I have a lot of time with my friends, even a weekday. If I call Dr. Amit Langote in like 7:30 and say, "Chal बैठते हैं," so he'll block my number the next day. So हमारे यहाँ चलता है. Anyone calls at 7:38, चल, चल. So that is some advantages we have. We have got a lot of time for ourselves. And I do play cricket matches with my hospital team and still doing some transplants and celebrating with the donor families. I think that's my talk. So, how many of you are from third tier cities? There are a lot of people. Do not hesitate to go back. You might have certain deficiencies. Now, see, your academics is available on YouTube. You've got excellent WhatsApp groups for support system. It's not like back 15 years ago when you had to attend a conference to get your lectures and knowledge right. So I would suggest go back to your hometown. It's a good chance, and your people will acknowledge you more than being one of the nephrologists out of 150 in Mumbai or Delhi. So that's my opinion. Thank you.
Thank you, Vilas. I think we should all congratulate you for establishing a transplantation in not in one institute, probably three places, and that too in a remote place. And there's a lot of learning from you for the youngsters. So as I was telling, it is interdisciplinary, and a lot of the other department support is required. The infrastructure, the manpower, the training, including the coordinators, and the most challenging was, as you said, is the legal clearance. And of course, even within the hospital, you should have the legal person to legally clear all the individual cases. So really congratulate you. And of course, you said the deceased donor also. Deceased donor has its own challenges. So having a neurosurgery department and the legal department to process, and then declaration and optimization. Do you have your in-house donations as well in your hospital?
All the 14 donations are in-house.
Okay.
Those are multi-organ donations, and all the other organs that retrieved have been, like including heart and lung, have been distributed all over the state and country. Okay. So all those 14 retrievals have been in this hospital.
Then I think it really you need a
so that is
big
14 organ donations.
Yeah. Pratik Das sir, any comments?
This is an excellent experience. I just listening to your experience. It's an inspiration for the young nephrologist, because every time we think of starting a transplantation, it is always a second step of your practice. It always requires the support, especially you have to have a running dialysis unit, that is either a PD or a hemodialysis, to support your transplant program. That is the priority. The same stories echoed when I was listening to Professor Kamrul Islam from Bangladesh. He was telling almost like of yours. They started with a 3-bedded hospital with a 2 dialysis machine. Now they are from the dialysis they are earning money and doing the transplantation free of cost. And now they are doing more than 150 transplantations. So it's a really an excellent one. There are and there will be the technical difficulties, legal hassles, that will be there. But passion is important. That I do agree with you. Any question?
Dr. Mukherjee, any comments?
Yeah, really good. There is a excellent, I think so. Your initiative and all these things, and many youngsters actually who are actually afraid of studying the transplantation, at least they will be role model and can see and how to just make it in a very conditions in a very small town. And another important thing is that you have the centers having the all type of things. There is one swap, ABO, beyond ABO, and also the deceased. That is also is a great, because Madam is telling, because Madam is now one of the pioneer in the disease donor transplantation. It's so difficult to just make a legal and monitoring and everything. So I am really, and another important thing regarding the cost, because in some state also they have some Ayushman or some